Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guests on the program today are all in the emergency medical field. We have Tammy Martineau, the Executive Director of Nursing and Health Science Programs here at Florida Gateway College. We have Ann Brown, Coordinator of EMT Programs here at FGC. And Marcia Morrell is an Executive Vice President at Century Ambulance. We'll talk about emergency medicine, where Florida Gateway College is, where the industry is. We'll do that when we come back.
A boy born in Joplin, Missouri was fascinated by anything with wheels and a motor. The odds of him winning both the Daytona 500 and the Brickyard 400 in the same year? 1 in 195 million. The odds of a child being diagnosed with autism? 1 in 88. I'm Jamie McMurray, and my niece has autism. Learn more at autismspeaks.org/signs.
Welcome back to Perspective here on Florida Gateway College Television. We'd also like to welcome the listeners on Black Crow Media to our program on radio today. Thank you for being with us. My guests on the program, Tammy Martineau, Ann Brown, and Marcia Morrell. Welcome all of you to the program today.
Thank you.
Emergency medicine is something that each one of you is involved in, and I want to talk first with Ann. Ann, you're in charge of the program here at Florida Gateway College. When we say emergency medicine or EMT, what does that mean at FGC?
There's a little bit of confusion about that, EMS, EMT, paramedic. EMS is the umbrella term, so to speak, for emergency medical services, and everyone who is providing pre-hospital care falls under that umbrella. EMT is the most basic level. It's emergency medical technician. That is a one-semester program, and that is a prerequisite to becoming a paramedic, which is a year-long program.
Now, what's the difference? EMT is just the basic, but paramedic gets more into life support, or how does that work?
Exactly. EMT is the basic level of care, and then paramedic does the advanced procedures, airway and cardiac monitoring, medication administration, those kinds of things.
Now, when you talk about EMTs, you're not necessarily working on an ambulance that is going to an accident scene or to a shooting or, God forbid, but these EMTs can be other emergency medical people. Talk about those careers.
It can. Of course, that's the exciting part of things when you think of a pre-hospital provider, but there are many opportunities, and that doesn't always appeal to everyone. So some work in physician offices as medical assistants, some work in the hospitals as patient care technicians in the emergency departments and those types of things.
Now, Marcia is with Century Ambulance out of Jacksonville, but you do have a organization in a lot of little towns. Talk about Century Ambulance and where you are and what you do.
Well, Century Ambulance Service operates or has stations in 6 counties in Northeast Florida, and our primary role is to do inter-facility transport for approximately a 10-county region in Northeast Florida. We do about 48,000 transports a year. We have 47 ambulances stationed in those 10 counties, or in the 6 counties, and do transports for 10 counties. Our other role is to provide what is called mutual aid response to the county EMS services when their resources are limited and they need backup for certain incidents.
Well, let's talk about, we've got some video to show what your people do in the field. I know that when you're talking about mutual aid, if something happens to where there's maybe a major disaster or something, you're on call, correct?
Yes, that's correct. It doesn't even necessarily have to be a major incident. Given a motor vehicle accident with multiple victims, multiple vehicles, school bus, anything like that, or it can be a site incident, a fire, an explosion, and hazardous materials. It can be a natural disaster such as hurricanes, where evacuation of facilities and special needs persons are required to be evacuated, and we do all of those things.
Marcia, in a smaller county, there may be just one ambulance for the whole county at any one. And I don't want to make light of Union County, but it's a small county.
Right.
They can't afford to have two units on at the same time. So that's where you guys come in. Should there be a need for additional help?
Well, yes, that's correct, but also in the smaller rural counties as well, generally they have quite a distance to travel to take a patient to the hospital as well. So that depletes resources even more when you have to travel a distance and go into other counties to drop a patient off at a major medical facility. Or if you have a smaller acute care facility in your area, that's where we come into play, that we would pick up the patients from those facilities and take them to a larger tertiary care center.
Now, so when you're talking to students and there are other opportunities, I think the glamour of television has made paramedics where they're, massaging someone's heart, and it really does a disservice to what EMT is all about. There are other important jobs, just as there are for those who are going to the scene of a multi-car accident.
For the EMT, which is the first program that you take, you have to be college ready. You have to be able to do math, you have to be able to do English, comprehend what you're reading. It's almost like a foreign language, the medical terminology that you pick up. So the EMT class is actually only 1 semester in length. It does have some time in the hospital where you go and work on patients in the emergency department, and you do spend some time on a rescue unit responding to 911 calls with the local pre-hospital providers. So there is a little bit of excitement there to kind of get them into that scope of practice.
So, I mean, when you're talking to a student that may, I don't really have to do that, I don't have to know math, but if you're talking cc's in an IV that you have to give to a patient, you better know what you're doing. I mean, because you're also going to be talking to a doctor at a hospital in contact, he's going to be guiding you through, or she's going to be guiding you through. So it's not just, you got to know what you're doing.
You're right, and this is a profession, and we're trying to promote that, and education is a real important step to that. You do have to be able to figure out medication dosages, more on the paramedic level than the EMT level, but even the EMT has to figure out how long an oxygen tank is going to last, those types of things. So math is important.
Marcia, you see kids that they come to you and they say, well, all right, I want to drive the ambulance. But Century has a requirement that you have to be 21 in order to drive an ambulance because of insurance.
Right. There's a couple of requirements for any entity that you are in EMS that you have to have for driving. First of all, you have to have what's called EVOC, which is Emergency Vehicle Operators Course. That's required by the state of Florida. You have to have that to drive any ambulance. Then, according to what agency you work for, their insurance underwriter has certain restrictions on you. Ours is that you must be 21 years of age and have a clean driving record. Also, throughout the industry standard now, anywhere in the state of Florida, there is zero tolerance for any type of impaired or DUI driving, reckless driving. If you have points on your license, they will only let you drive for certain amount of points, and given what those circumstances or what the points are for. And in this industry, a DUI is a no deal.
We talked about this a couple weeks ago. I think a lot of kids don't think that that's a big deal, but it is a big deal.
Well, in the industry, obviously you have to be able to switch from patient care to driving the vehicle given the circumstances or what the scenario is, what's going on at the time, how many people need to be in the back of the truck with the patient, and that sort of thing. So you have to be able to drive. So a clean driving record, the EVOC course, Emergency Vehicle Operators course, and the ability to drive well are certainly as important as your ability to care for a patient, because it limits what you can do, and it also limits your availability for hiring practices.
So young people, if you're messing around now and you want a career in EMT, getting in trouble is not a good thing, because the people who are hiring, and we're talking to people here today who are hiring, so it's not a good, and she's telling us that it's not a good thing. So that's the way I believe all industry is going to be, if they're not already. And I wanted to talk to you about the basic program is a 1-semester course.
Correct.
What will they be learning specifically in that 1 semester? That's 16 weeks.
It is 16 weeks except over the summer. Over the summer it's a 12-week course. In that time you learn how to take care of medical patients, trauma patients, how to assess the scene. You will learn some hazmat information, pediatrics, obstetrics, all kinds of good fun stuff. You spend some time, as we mentioned, in the hospital as well as on the rescue units. And at the end of that, you should be prepared to go take the state certification exam. Also, you're eligible for the national certification exam. And once you get that credential, you're good to go to work either on an ambulance or in a hospital, wherever you want to use that EMT skill. Also, we did mention a lot of areas, industry hires these folks to work on any type of occupational health type thing, hires EMTs as well.
Okay, so but you have to, you can go through the coursework and just barely pass. The deal is you got to pass the exam for certification.
Got to pass that
Century's not going to
exam.
hire you. Local EMTs at any county in North Florida are not going to hire you until you're certified.
That's correct. It's also great for points if you want to get into the nursing program, which is a very competitive program at just about any school here as well. Having that EMT certification gets you extra points into the nursing as well, so there's an added little benefit there.
Now, Tammy, I know we're not going to forget you today. You're the Executive Director of Nursing and Health Science Programs here at Florida Gateway College. We all know that EMT is an entry-level position. It's students should be striving for paramedic. They should be striving to, because the more education you have, the more money you make in emergency medical, in anything you do. So let's talk about the next step, the paramedic. You go from EMT, and then there's paramedic. We do that, and we do that very well. So, I mean,
Yes.
And then on top of that, we've got a new program that we're going to start, paramedic to RN.
Yes.
And you're really excited about that.
Very excited about that, Mike. We are fixing to enroll our first class that starts on May 15th. Our deadline for application is April 1st, actually, so it's coming up. But we're very excited. It's a new program that Florida Gateway College is excited to offer. It's going to enhance our paramedic program and offer higher education to those paramedics that are out on the field right now that are looking to take that next step and come into nursing, because I believe that paramedic and nurses complement each other, either in the field or in the emergency department and hospital setting. So it's a 4-semester program. It's student friendly. We're going to offer some night classes. We're going to do some weekend clinical rotations. We're just really going to try to be real flexible to accommodate a working professional schedule.
And that's important, because I think a lot of people who are paramedics making pretty good money, the incentive is to make more, but when you're working long shift hours, 12-hour shifts sometimes, it's good that the college is going to work with people to get that RN.
Oh yeah, that was one of the, when we developed the curriculum and really looked at what the community needs are with the paramedics in North Florida, that was a huge response back, is that they really need us to be flexible. So this will be our first year. Of course, this will be a year that we'll work out all the little quirks that are going to happen, but we're going to start offering some online courses so that they don't have to be on campus as much. Again, just really trying to accommodate the needs of a working professional, and trying to go back to school with a family and reach higher education.
And even if you become an RN, you can still ride an ambulance if you want. I mean, Marcia, do you have RNs riding with any of your people?
We do. There are a lot of specialty programs, in particular pediatric critical care, neonatal critical care programs, adult intensive care, transplant transfers. There's a whole list of type of specialty care transport systems that are available, and they require paramedics, RNs, and respiratory therapists for those.
And there's also the helicopters now that
Right.
and I know there are RNs that are in helicopters.
Yes.
How valuable, I know you're a paramedic, how valuable is it to have a nurse out in the field? And Tammy, maybe you need to speak to this. Not, or I don't want to put you on the spot, but that nurses sometimes speak language of doctors who are sitting back at a trauma center somewhere. So you can still become a nurse and ride in a helicopter and have that exciting.
Oh, absolutely. There are many paramedics out there that have already gone and reached their nursing and still stay in a role of a paramedic, but have the ability to do those extra skills that might be needed on a flight or transport. There are emergency departments that use paramedics and nurses in different roles. Again, we're looking for that collaborative blend in healthcare now, where we're really looking to complement the paramedic and the RN. It's not just the paramedic drops the patient off in the emergency department anymore, goes, okay, all yours. There's teamwork, there's communication, there's patient care, there's continuity, there's all kinds of things that we look at from a nursing perspective that, paramedics have a critical thinking component, nurses have a critical thinking component, and we just need to blend that and complement that.
And you're building your credentials, basically.
Absolutely.
And you're becoming more valuable to any kind of healthcare setting. Marcia, when you're hiring someone, and what are you looking for? Are you it's hard. There's a hard to have an application that says these are all the things we're looking for.
Right.
There's some intangibles there as well. But when you're hiring somebody, what are you looking for?
First is the driving record. Second is they have to be free from any type of addictions. Because of the industry that we're in, our medical director at any point can require drug analysis on anyone, and we do it for every incident and every accident because obviously we have a huge liability with patients' lives in our hands. They must be a certified emergency medical technician, a certified paramedic with the state of Florida. If they have not received this, once they become employed with us, they are taken through the paramedic critical care transport program. Part of the other criteria that comes with those things is American Heart Association basic life support, advanced cardiac life support, and we require pediatric advanced life support for all of our paramedics, no matter what. And then you get into some of the other specialty trainings after that. One of the, I guess, the wave of the future for our industry that we're trying to figure out at this point is the changes in healthcare, in particular with healthcare reform and reimbursements. We're looking at paramedic community medicine now, and outreaching more into preventative and wellness care rather than sickness care.
Do you know what that's going to mean for folks like Century? Are you going to do clinics? Is that going to be part of it, or are you just kind of waiting to see what goes on?
Well, not necessarily clinics, but an extension of health system, health care in the field, pre-hospital. There's obviously a big drive to provide primary health care, which would include triage and assessment and treatment to people to determine whether they need to access a hospital emergency department for admission.
How much pressure is that? I mean, it's going to be a lot of pressure. You send a paramedic in the field because someone is complaining of chest pains, and when the ambulance gets there, the chest pains are gone now.
Right.
And do you take them still to the hospital, or, I mean, I don't envy the situation that and I don't mean to make light of it, but it's going to be tough.
It will be tough, but most of what we do is all under standard operating protocol or standard operating guidelines, as they're called now. But there still is the aspect of assessing the patient, getting their history, trying to look at their immediate signs and symptoms and their vital signs. With the technology that we have in today's environment, we can do such things as do a 12-lead EKG and transmit it directly to the hospital. There's a lot of testing that is going to be available and is presently available in the field that can be sent to a physician at the hospital to make determinations immediately.
And Marcia, we wanted to show your folks in action. Carrie went out and did some videotape work, and I want you, if you would, to describe what we're looking at. Well, actually, this is our place, I think.
Well, this is a CPR class, it appears to be. They're training, it looks like certification, because these look like these are emergency medical technicians, and this is vehicle extrication, where they're teaching them how to extract someone from a motor vehicle accident without further injuring them and stabilizing their cervical spine system as well.
And there's rhyme and reason for doing what they do, correct?
Absolutely. You certainly don't want to further the patient's injury or endanger them. However, most of the work has to be done expediently, but stabilization of the patient is the priority.
And I think this is we actually have a box simulator at the center.
This patient is being defibrillated at this time, and it looks like that they're about to intubate him. So all of these skills are skills that are real life skills that are utilized in the field, but obviously they take quite a bit of practice to perfect them. And these things are all taught through the Emergency Medical Technology program, and they are daily uses in the field.
And here we have an actual transport.
Yep,
this is at your place.
Yeah, believe it or not, this is one of the more dangerous things that we do.
Really?
Loading and unloading patients. The stretchers now are hydraulic powered stretchers, and so that certainly helps prevent with back injuries in the field, or back, neck, shoulder, which have been some of our primary industry problems with workman's comp. Yes. And these prevent this now, but loading and unloading the patients is extremely dangerous.
Well, I don't mean to be callous, but you don't know how big the person is going to be that you're going to get. So, I mean, you don't know whether you're going to need help.
Right, and bariatric programs are one of the growing programs in our industry at this time, and there is different equipment that is adapted specifically for bariatric patients. And then you get into some of the specialty services that we talked about, neonatal transport services. Their Cavitrons are several hundred pounds on top of the stretcher.
Now he's putting EKG leads, or?
Yes, sir. He's putting, it appears he's putting a 12-lead EKG system on her. And again, that can be transmitted directly to the hospital.
So during the trip, the doctor can see if there's any problems occurring and can send instruction on what to do to avoid a situation.
Yeah, that goes back to our standard operating procedures or standard operating guidelines. There are specific types of heart attacks now also that interventional cardiology is the key to it. And those EKGs are transmitted immediately to the hospital, and the emergency room physician and the cardiologist make the determination at that point to take the patient directly to the cath lab or not, because that is really the only intervention for that patient.
Because at time in that situation with strokes and heart, time is of the essence.
Yeah. So there's a window of time.
What about being in shape? I mean, you think of young people in this kind of career. Does it help to be in shape?
Absolutely. We, our company, Century Ambulance Service, requires a physical fitness test pre-employment, and then you also are required to do that again annually. And obviously that is in order to help our employees not become injured and help reduce our liability. But we actually have had incidents where we have had employees who we discovered healthcare problems within them that they weren't aware of when they went to take their PFT, and referred them to their physician after that, and they ended up having interventional cardiology. There's a whole list of things that they have to do. Again, back, neck, and shoulder injury are huge in this industry, and so endurance is another issue. They have to do exercising to show that they have endurance to be able to, for example, extricate a patient from a car, cut them out of a car and be on scene for a while, carry someone up and down a flight of stairs, you know, real life issues that take place.
Yeah, a three pack of cigarette a day is probably not going to help you in this career, because you got to be able to work and lift and do things. Let me ask about enrollment. We have a program that allows students that are in high school and
Dual enrollment.
dual enrollment. Talk about that. Is there some requirements that kids must meet before they get into a dual enrollment?
There is. The dual enrollment program is a great asset for us as well as for the students. They're able to earn college credit while they're in high school at no cost to them. It's an unbelievable opportunity. They do, however, have to be college ready, and for our program they have to be 18 since they're out riding on rescue units in the field and that kind of stuff for insurance reasons as well as a multitude of other problems. They have to be 18 before they can start their clinicals. But it's great to be able to graduate high school having a certification that enables you to go directly into the field.
Change of career, is this something that someone gets laid off in this terrible economy? There's jobs out there available.
There are, and we get everything from the dual enrollment student to retirees who are looking for a second career or a career change. It's a great opportunity. One of the things that appeals to people about this profession is the shift work. You work 3 days a week. They're typically 24-hour shifts. It depends on where you work. There's 24, 12, 8. There's peak time trucks where you work 10 to 10. There's the opportunities are just about endless as far as scheduling goes, which again is what makes that paramedic to RN bridge very appealing, because you only work 3 days a week. It's great to be able to have another income opportunity.
Marcia, I noticed that one of the guys in the video we saw is Mike Mahoney, a friend of mine that was with the sheriff's office. I think maybe he may have retired and now is doing this as a second career. So, I mean, there's the opportunities are out there. All you got to do is apply. If you'd like more information about the programs here at Florida Gateway College, you can call Ann Brown. Her number is 754-4292, or you can reach her via email, ann.brown@fgc.edu. Thank you all for being on the program today.
Thank you.
Thanks for having us.
Thank you for watching Perspective here on Florida Gateway College Television. Until next time, I'm Mike McKee. We'll see you next time.